This study was taking a look at those who were at higher risk for certain cancers, such as colon cancer. This is video of a colonoscopy at Bethesda North Hospital. It can check for polyps if you know you are at risk and then remove those to lower the risk. Traditionally, to have genetic testing, counselors look for certain family traits and screen for a small number of genes. The conclusion from this study, however, that was published today in the journal Oncology, well, we may need to expand that testing. The study involved more than 450 patients from the state of Ohio. Many who participated in the tri-state were known to have a collection of risk factors for cancer called Lynch Syndrome, which means
there's an inherited gene passed on from either the mother or father to children, and if the gene is passed on, or an abnormal version of that gene, it increases the risk for colon and sometimes other cancers like uterine, ovarian, stomach. We can see kind of a variety, but the primary cancer is colon.
Researchers at The Ohio State University Comprehensive Cancer Center found 1 in 6 patients diagnosed with colon cancer had at least one inherited genetic mutation. Under current screening guidelines, however, a lot of those patients would never be found. Usually, to suggest genetic testing, counselors such as Courtney Rice of Tri-Health say they look for certain traits.
So the things that I would look for if I'm working with a family are if there are colon cancers diagnosed at age 50 or younger, if there are multiple people closely related with colon cancer or with some of these associated cancers like colon and uterine together in a family. We look for multiple generations.
Now, if they find that, this study shows we may need to broaden that criteria and the number of genes tested so people at risk don't get missed. The hope is that you find out if you have a gene mutation linked to colon or another cancer, you could start screenings earlier than traditionally suggested. A lot of that screening now allows for intervention. You have a colonoscopy, they can remove polyps. Yeah. If you screen for uterine or some of the others, some of the medications now can help lower risk. You know, we've had breast cancer survivors on medications now for years. We're starting to look at these other cancers the same way.
Okay.
Yeah.
Can you get it covered by insurance if you just say, I want to
have
this done?
Actually, they have made huge progress with that. If it's suggested that you meet the criteria, which is why in the guidelines you have to expand the criteria. Yeah. A lot of this now is covered by your medical insurance plans because it's cheaper to find it early, remove a polyp, than it is for your insurance company to pay for cancer surgery. Absolutely.
Good, that's great.
Yeah, making progress. All right, we're back at 5:30 to talk to you about a new kind of diet that could help your gut.
Ooh, all right.